So it's now my pleasure to introduce Isabelle Peretz, who all of you have seen this morning. And Isabelle's talk this afternoon is going to focus on music, language, and intervention and the power of singing. So that was a perfect lead-in question. Thank you.
Thank you for asking the question. So let me start with a legend that you all know, but just to remind you of the power of singing. With the Odyssey book, I suppose you all know that, oh, it's cut, okay. That legend, the sirens were so powerful that someone would just drown himself in the sea unless, like Ulysses, he was asking to be really tied to the mat of the boat, just to remind you of the story. So, yes, singing has a power on us, and we all believe that it starts in the maternal universal way of dealing with babies by singing. There are lots of studies, including work by Laurel Trainer, showing that infant-directed singing is more powerful than adult-directed singing. And here is just one study among many from Sandra Trehub's lab in Canada, Toronto, showing that it regulates, infants pay much more attention to the mother when she is singing than when she is speaking. And in another study, she showed that it decreases cortisol level. I'll come back to that. What is interesting is that it is really a universal trait. All mothers and fathers, to some extent, do sing to their babies. And I like to illustrate, just because I have those lovely clips taken from, oh, sorry, I should show you where it is. It is in Asia, in Central Asia, and I can't pronounce that word even in French, which is whatever, it's there. And the ethnomusicologist, Frédéric Léotard, is going there every year to collect these kind of clips because, as David Turan was saying, it is an urgent thing to record singing around the world because it's going to disappear. So let me just illustrate. This really common activity is to sing to an infant. And I like to emphasize aspects of this kind of singing, which is very simple, using fixed pitches and a regular pulse, of course, to rock the quadrille, I think, is really basic in this activity. So it promotes synchronization, and I will come back to that later. And what you may not know, in those villages, they also sing to their domestic animals.
Sjouwem, sieren, sjouw, sjouw, sisjen til de vrouwen. Schupte asap, sjeur, dit is de salsa, sienier, sjouwem, sjouwem, sjouw, sjouw.
And in fact, the structure is identical to lullabies. And they say that they do sing to babies or to their animals the same kind of song, except sometimes they change a few words. So, but singing is not only for infants. Singing is also the most widespread mode of musical expression, and I like to emphasize that it is easily accessible and affordable, and you can sing across the whole lifespan, from babies to old people. And what is really distinct, I think, from speech, it is a participatory activity. You do sing along, like in that picture. And it is very important in rituals. So, and it is also, as a few of you have asked, a natural alliage between music and speech. And this is really the aspect I'm going to focus on, because it has been a widely held belief that it helps memory, that singing helps memory for words. However, I may disappoint most of you because I will show you that it has a very limited effect on memory. But in the meantime, I'm just telling you how I will present this. So the work I'm doing is really patient-based approach. I'm using patients to understand how it works in the brain. And so, of course, it is tied to perspectives in therapy. So I will address that at the end. So the efficacy for memory and the reason you all believe music really helps memory for words, or it's because of the oral tradition. As you may know, in the past, history was really transmitted through minstrels by oral tradition. And also, you know, especially in the US or in English, you use alphabet songs to learn the alphabet. Jingles, commercial jingles use also music to publicize brand names. And of course, there is a tight coupling between lyrics and tune. And as Annie has emphasized with in more details, and I could call that the opera now hypothesis, and no longer the overlap of neural pathways or recycling. It's one very important hypothesis now, and one fervent advocate of that position is Annie Patel, that it is really those shared features that makes songs so special for humans. But there is another explanation, and they are not necessarily mutually exclusive, but I think that the data I will present to you will favor this interpretation over the other one at the end, but we can discuss that. That it is an emotional enhancer, it improves mood and engagement, and because of that, it will facilitate some processing, not all, and to some extent. So we can also call about singing on music as a super expressive voice, something that is really powerful because it is exaggerating what the voice can do, because music can have much more breadth by using much wider pitch skips, more extreme rhythm aspects, etc. But I will not develop that. So let's focus on really tune and lyrics and memory. And this is true that they are very hard to separate for familiar songs, that is the song you have known forever. And let me just illustrate that with one study we did a long time ago on using a priming paradigm. This is a very classical situation in psychology. You present two words like nurse and doctor. They're going to prime each other in the sense that doctor and nurse are highly associated. So if I ask you if nurse or doctor is a word, and I present the other word before, you're going to be faster than if I present dog before nurse, because they are unrelated. So we did the same kind of situation with music, with tunes and lyrics coming from either the same song, like To You and Happy Birthday, or from a different song, like Bring Back and Happy Birthday. And what we found, and we used all possible aspects, that is, they were both spoken, one was sung on la la la, or was even played on an instrument, and we always find a very robust, robust priming effect. Sorry, it doesn't appear on the slide, but it is always faster to respond to related events than unrelated ones, and also more correct, showing very robust priming effects across domains and inside domains. And what it means is that it is automatically associated in memory. So what does it mean? Is it really integrated? It's another issue we will address later on. And I'd like to illustrate that with the musics too, thanks to Annie to introduce very briefly, and I won't really explain to you what it is, the case of tone deafness, but these people have a very poor perceptual ability to track pitch variation in melodies. And as a consequence, most of them sing poorly. So you will listen to her. She's not the most severe cases, so it's not as good as other cases. But what is really typical is that they can sing with words to some extent. I mean, it's not correct, but they cannot do it on la la la. So let me illustrate that with a video.
Mon cher Michel, c'est à ton tour de te laisser parler d'amour. Mon cher Michel, c'est à ton tour de te laisser parler d'amour.
À toi.
Mon cher Michel, c'est à ton tour de te laisser parler d'amour. Mon cher Michel, c'est à ton tour de te laisser parler d'amour.
Très bien. So now she will do it on la la la.
La 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 la, 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 la 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 la.
La 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 la, la la. M'excuse, mais ça,
Non, hein?
non.
Mais tu l'avais au début.
Ouais, mais je sais pas, c'est comme si j'enregistre pas ou je sais pas quoi.
C'est ça, c'est parti, hein?
Ça fonctionne pas.
Oui. And they all do that. And what I didn't mention is that this song is like Happy Birthday in Quebec. Everybody knows that song. Of course, we use an imitation study to make sure that she knows it, but she knows it. I mean, she can sing the same way from memory, but on La La La, she can't. Everybody else can, of course, and sometimes it's even better without the words because they can pay attention to the pitch dimension. So it seems to be really highly integrated, except that it is for highly familiar songs. It's a different story when we focus on acquiring, learning a novel song. So for the moment, it does support the idea that it is strongly integrated in memory and that one can benefit the other. So now what it is to learning lyrics, and the question was to sing or not to sing. This was also earlier work published in 2007. And what we showed in that study is that it was in normal students, in musicians and in non-musicians, is that music interferes with the recall of lyrics. So here we have the mean, we tested non-musicians and musicians, and when it was, we presented on a singing mode, and the person has to repeat it on a singing mode. It was with 60% on average of word recalls, correctly recalled words, while when it was spoken, that is, it was sung when it was presented, but we asked the student to repeat it in a speaking mode. They were at 70%, or more or less 71. So it's higher, and as well as on the divided spoken mode, that is, they had to speak again. I mean, I won't go into the details of why we control for the encoding, but it just shows that it is much more difficult to learn the tune and the lyrics and to be able to remember them. It's much easier if you can focus only on the lyrics. And musicians don't do better, even if, at the brainstem level, there might be something special. But usually, we don't report these kind of differences. And I completely agree with Gottfried Schlag, what he said. Well, it's not easy to do this kind of study. And even correlations like these ones are not easy to publish because we want to know, we want to show that music helps. Yeah. So the conclusion is, if you want to learn something, don't sing, or at least use a tune you know beforehand, that is a familiar tune. And that's what usually we do. When we want to learn something like the alphabet song, we use a melody that is well known and well memorized. But as we said, and it was mentioned several times, songs seem to be so special in the clinical world, and I'm turning now to the clinical world, starting with dementia. I don't know, yeah, I'll start because I asked if it will be presented. It's something that you may have seen on YouTube because apparently millions of people have seen it. But for those of you who haven't, I will just present a few the first few minutes. It's typical case, and I know there are many neurologists in the room. You have seen those patients, Alzheimer patients, and when you present something they know, very familiar, they just wake up. And this was a drastic case that is on YouTube, and I think Conchetta is really involved in that research, as well as Oliver Sacks. Oh, sorry.
I have one resident that barely opened her eyes. She didn't respond. As much as I tried, I knew her for 2 years. No matter what I tried, massage wouldn't work, nothing worked. When we got introduced to the iPods and the family told me the things that she liked, it was amazing once we put the iPod on her. She started shaking her feet. She started moving her head. Her son was just amazed. Okay, can we stop? Because now I'm getting all I'm seeing her all over again.
Hi, Papa. Hi, Papa.
Huh?
How you doing?
I'm all right. I'm fine. Wait.
Who am I?
I don't know. Wait a minute. I don't know.
Okay, it's Jerry. How long has he been in the nursing home? Approximately 10 years. He was having seizures, and my mother couldn't handle him at home. Of course, it affected me greatly because he was always, fun-loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop and do Singing in the Rain. He would have us jumping and swinging around poles. He was, he was good. He was always into music, always loved singing, dancing.
His name is Henry Dreyer.
Uh-huh.
And I'm looking more or less for religious music for him.
Okay.
Because he enjoys music and he always quoting the Bible. So I'd rather have that for him.
We first see Henry inert, maybe depressed, unresponsive, and almost unalive.
Henry.
Yeah?
Henry.
Yes, sir.
I found your music. You want your music now?
What do you want me?
Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. His face assumes expression, his eyes open wide. He starts to sing and to rock and to move his arms, and he's being animated.
So I'm stopping, I'm sorry. You can watch on YouTube, and after that he will speak a lot. I mean, he will really be alive again for a while. And I think it's not a miracle. It's not just one single case. It is, I mean, you do see this kind of how music can have an impact on demanding patients. And this motivated a student of mine who had the courage to teach singing. I mean, because she was convincing that by singing, Alzheimer patients will learn novel verbal information, that is through lyrics and singing. So let me show you how she did it with a case. These were mild cases of Alzheimer.
On ajoute la troisième ligne.
Il y a tout mon cœur et mes rides.
On fait ensemble.
Il y a tout mon cœur et mes rides.
À vous cette phrase.
Il y a tout mon cœur et mes rides.
Parfait. Et maintenant, on entend tout ça ensemble depuis le début.
Dans cette petite boîte vide avec un ruban de velours, il y a tout mon cœur et mes rides.
On chante ensemble?
Dans cette petite boîte vide avec un ruban de velours, il y a tout mon cœur et mes rides.
Bravo.
Dans cette petite boîte vide, il y a
avec
un ruban de velours. Il y a un bois. Non, il y a des rides.
Oui.
So everything is in this video clip. First of all, maybe you noticed, but the lyrics are novel. I mean, you don't, of course, understand it is in French, but the music is not. Did you recognize it? Okay. And this was one of the conditions, of course. It was to help them by using a melody they knew. Also, we did everything to help them. We repeated very often the lines. They could sing along, etc. And we test. She tested 8 Alzheimer's patients and 7 controls, and the conclusion in immediate recall is, well, not too good. As you can see here, I will go through the slide. Here are the controls, and they show exactly the same pattern. That is, by recalling in the speaking mode and by encoding in the speaking mode, it was much easier than when it was sung on the original melody with a new melody, but even on the Beethoven hymn, Joy, how do you say it? I'm sorry. Thank you, Ode to Joy. It was not matching the spoken mode. So even with a familiar melody, it was already difficult. In delayed recall, it's a little better. It's easier when it was encoded really with a melody. So there is something here that is really, over time, you do learn the two together, and then the melody is helping the memory. So you see my point. It's like for familiar melodies, over time, you will have a benefit by learning by singing. So she tested them over 3 months. Every 2 weeks, they had to learn and relearn the same songs, either in a speaking mode or in a singing mode. And it's only after retesting at the end, after four weeks of delay, that the sung mode was winning against the spoken mode. That is, the advantage for singing over speaking was only seen at the end of the 3-month period of training. And what was also striking is that, in general, they really wanted to record the information by speaking, which is not a problem, but it shows that the two elements are really independent, that they can have access to the lyrics or the melody independently. And this is, something that you can see here. It's
Dans cette petite boîte vide avec un ruban de velours.
Parfait.
Oh, c'est la chanson.
And what is she's saying, oh, I've broken the song, because she realized she could no longer remember the melody. And with time, they do remember both. I mean, they use the singing mode increasingly more over the period of testing. So yes, singing helps over time, but learning a novel song is a dual task. That is, you have to learn 2 components. And coupling between tune and lyrics is laborious and time-consuming. So we really have to think about what we are doing in therapy, about how, well, I'll let you decide later on. But what was really clear is that it is a highly pleasurable experience. None of the patients, the attrition rate was 0. They all participated until the end. They were never sick. They always wanted to participate to the study. And well, I chose this example. He will sing, and you can see the pleasure, some pleasure in it.
Ouais.
C'est tellement, tellement difficile de trouver quelqu'un qui vous aime. Si jamais vous trouvez cette âme
Hey, impeccable.
And that was really at the end. He really got it and had a lot of pleasure. Same thing in aphasia. Now you may hear a success story tomorrow with Gottfried Schlag, but in our lab, we never succeeded to find that really singing words, that singing helped to pronounce words in aphasia. Aphasia is a neurological disorder that after stroke, patients can no longer express themselves. And there are different degrees of severity. Some can also understand well, some less well, but in general, it is really an expressive disorder that we can, it is called the Broca's form of aphasia. And the classical teaching in neurology is that they can pronounce words by singing that they cannot pronounce otherwise. And in our experience with aphasics, we could never find this support for this claim. That is, they could only sing the words they were able to pronounce. And we tested several cases. This is a group study, and I'm reporting just to give you the flavor of how they sing. For example, for familiar song, you will hear, we always use also a repetition paradigm because imitation is something that is really basic and shared by, in different conditions. It's really one of the most optimal conditions to study production because this is rarely done in the lab. Here, for familiar songs, you will hear one case.
Il est né le divin enfant.
Le divin enfant.
And same thing while speaking.
Il est né le divin enfant.
Le divin enfant.
So of course, here it's just one example, but if you analyze syllable by syllable or word by word, you will find exactly the same amount of words recalled while singing or speaking. And when they had to learn the songs like I showed you in dementia, they again show no advantage of singing over speaking. However, we did find an advantage when they were singing along. So let me just play this for you.
Il est un mort, tu payes là.
So you heard two things. He was singing along, of course, and with a lot of pleasure. Now speaking along.
La la la.
J'ai pipi, j'ai mots d'air amitié.
Well, when you analyze again word by word, singing wins in this condition. But of course, we never speak together with someone else. It's something that is really special for singing, and I'll come back to that. But what I'd like to say that we are not the only one to fail to show this effect. Recently, there was a study done in Germany, and they found the same thing, despite the fact that they used the optimal condition, that is the condition to sing along with someone else. So, to summarize, I don't want to be to depress you. It is a pleasurable experience. So the point I was illustrating that really music is coded separately from speech in memory. So whenever you this kind of situation, you have to keep that in mind. So song learning is a highly demanding task. So for challenged people, it may be too much because what I didn't really specify earlier on is that the Alzheimer patients had a mini-mental score that was higher than 26, which is quite high. But it is highly pleasurable, especially in duet singing. So I do think that if you find an effect on memory, we don't find much. We do find over time. It's maybe part of it is because, of course, of the link in memory that is over time rehearsed. Of course, it is the depth of processing is higher when you encode with a link between the two, but it is mostly because it's such a source of pleasure. And it is what is related in the literature, and I like to mention the first textbook, in fact, with a similar topic as the one of this symposium, which is called Music, Health, and Well-Being. And there is a very nice chapter, very short, covering the research on singing for those of you who are really interested to know what's happening. Because, of course, I'm presenting only what we have done in our lab, but there are other studies out there. But I'd like to mention a few things that is really recurrent and that everyone would be saying about singing, that it is a mood enhancing, even to the point of producing feelings of euphoria or to be on a high for a singer. It relieves stress and tension. It improves breathing and cardiovascular function, voice quality, and posture. And I think everyone who has had singing lessons know that this is really an important part of singing. And also what I like is that it distracts from personal worries, and I think it's an important part of musical activities like singing, is that you cannot ruminate thoughts. And it seems to be more effective in women than men. So the benefits for the quality of life are huge. The benefits for cognitive functions, questionable. And what is the neural basis? I think you heard a little bit about what it could be. I mean, Robert Zatorre presented the release of dopamine as a very important source of this pleasure. So it's related to, well, I don't have to emphasize this. And it may, of course, the effect of these positive emotions is that it may enhance general arousal and mood, and of course, cognitive functions in general. But I would argue that these effects are very small. Also, what we have observed in the lab is that it reduces cortisol level. The cortisol is a hormone that you can measure in salivary samples, and that is associated to stress. So if you present music after a very stressful event, such as giving a speech in front of a committee, and that is the situation we use with the students, then of course the level of cortisol is elevated after this kind of events like you have here. But if you present music in the rest period after the stressful event, the cortisol level really decreases very quickly. And this is something that has been measured in other situations related to music. I mean, we didn't have a control situation here, like language one, story one, but I would predict that music really it has a much more powerful effect here. Still, the future directions are that maybe in those two situations I mentioned with dopamine and stress and cortisol, it was related to music listening and not to singing. However, I think that singing is more effective, might be more optimal to regulate hormone levels. But these are perspectives for future research. Is really singing more effective than music listening? I would say yes, because of all the reasons I presented earlier. Does speech contribute to this effect? This is an open question. For example, well, no. Does duet singing enhance this effect? And the reason I'm asking those questions is because my favorite theory of why singing increase is beneficial for the health is that singing increases group cohesion, and that's an evolutionary aspect that can be tested. And as presented earlier by Annie, I think this morning, is that it is something that we can test, that is singing together will increase synchrony. I mean, I think I have a slide here, that synchrony and coordination is increased. Cooperation is increased in economical games after singing together than while doing singing, but not at the same time. That this is the study that was published in 2009 showing that this effect, and Annie presented another study. But what I'd like to go back is to, just to summarize, it's by, of course, maybe the origin of that is the bonding between the mother and the infant, the and the features of music that promote singing with someone else. And an idea that is actually interesting, has been published by Dunbar recently, is that singing may replace physical grooming, in the sense that it is a pleasure that you can give to one or two, to one animal at a time, or one person at a time, but by singing and singing together, you just do that at a large scale. And I'd like to finish on this mass grooming effect. You may have seen it. 10,000 singers. And I'm pretty sure they were all on a high. Thank you for your attention.
So questions for Dr. Peretz? Yeah.
I have one. I have short-term memory loss. I'm a cancer survivor from massive chemo, and I sing in contemporary choir. And if I just have to sit there, we learn a lot of music fast, and if I just have to sit there and try and learn the words and the music, I can't do it. But if Lissa allows me to stand up and add movement to it, I can learn the piece. So I've just wondered if you've looked at you've had people sitting there. I can't learn the new pieces unless I'm allowed to stand up and move literally tap my foot. If she wasn't allowing me to tap my foot, I can't learn the piece.
Very interesting, because that's the point I forgot to mention. At the beginning, I mentioned that really the infant singing, and also to the animals, it is really regular, and it's related to movement. We haven't studied that much in singing, except the melody intonation therapy that I think Gottfried will present it tomorrow, involves also moving the hand, and I believe it's a very important part of the arousal system, I think. Yeah.
Great question. Yeah.
I'm not a scientist, I'm a music educator, and I've been doing it for 32 years, and I would be curious to know if you ever did this work using musical accompaniment and not doing it a cappella, because it's pretty high level. You know, you have to get relative pitch and all of that, and maybe using some sort of musical accompaniment. And as you said too, the gestures are certainly something that really help, and I just like to
No, sure. We have, to some extent, I prefer to use someone else than accompaniment, because of all the advantages of singing along someone else than having an instrument, because there are reasons to believe that it's easier to sing along there are lots of arguments to believe that, or to think that singing with someone else is much easier than to sing with the piano, for example, as accompaniment. But there are a few studies showing that it helps. I think singing with someone else helps much more than an accompaniment. But what I like to emphasize is that we try to be scientific here. We do ask clinically relevant questions, but we need to measure what we are doing. And production studies like these ones seem to be very, very easy, because I'm illustrating that with the video clips and trying to de-emphasize the data that are behind that. But imagine every single pitch has to be analyzed from the production. That's a lot of work. So if you have accompaniment in the background, it's very difficult to isolate. That would be one point.
You could just use a microphone. And I think the rhythm, too, aspect that they were referring to earlier might help,
Sure.
Yeah.
So thank you very much for this talk. I think there was a lot of new material there, and I really also liked the frankness and the openness, how you presented the dementia data, because I think it tells everybody how difficult it really is to show something that may be obvious to some in anecdotal studies, but to actually really show the effect of this, I think might be really difficult. I wanted to make one point, and maybe a point of clarification, but maybe also get your response on this. A lot of the studies, when they look at singing, speaking, dissociation, in stroke patients, they usually assess this just at one time point. And they may just assess how well do these patients in repeating phrases in a sung and in a spoken mode. And that would have been one of my criticism of Stahl's paper. I found actually the title too strong to suggest then, based on this one level, on this one-time assessment, that because they may do better with rhythmic clues than with melodic clues, that then means that melodic intonation therapy is not going to work. I think that would have to really then be shown and challenged in longitudinal therapy studies.
Yeah.
And I'm pretty sure there will be some studies that won't be able to show it, and other studies might be show it, and I think that's the challenge then for us to bring this together. But I think with this particular study, I think to conclude, not your study, but Stahl's study, we basically conclude that based on one-time assessment that therapy is not going to work without having tested actually that therapy. I think that's a little bit too strong to come to that conclusion.
No. I think we agree. I think I made the point clear that to start with, it is a dual task, so that speech will be will be more. It will be more difficult to recall by singing or to repeat by singing than by speaking, to start with. Over time, I think I showed, at least in dementia, that there is a benefit, but it takes so many sessions. So basically, we agree, but from the start, initial state, there is dissociation. And they didn't really have a dissociation, they didn't have an effect, so we agree.
One final question, Josie?
Yeah, Isabelle, I really enjoyed your presentation. In fact, I'm really enjoying all the presentations, but it was terrific. I have one quick comment from an NIH perspective, and then one quick comment from a personal perspective. To everyone, really do publish your negative studies. They're so important for the field. And the fact that you didn't have measures that allowed you to document benefits the way you expected is important for the next set of studies. Doesn't mean there isn't benefit, it just means that the benefits aren't being captured by the measures you've got, and it's just so important that the negative work get published too. And one quick side comment as somebody who felt with this tone-deaf person, we actually prefer the phrase, not strong at matching pitch.
Thank you, Josie. Thank you, Dr. Peretz. That was great.